Picture this. It's midnight. A 70-year-old man lies asleep, snoring so loudly that his wife covers her ears with a pillow. Finally, she gets up, frustrated, and moves to another room. Now let me ask you, is snoring just an annoying sound, or could it be a silent danger to your health? Here's the shocking truth. Snoring is one of the top 10 most searched health questions worldwide in 2023. Millions of people, including older adults, are desperate to know how to stop it. But most don't realize that snoring is more than noise. It may signal a serious condition called sleep apnea, where you actually stop breathing during sleep. I remember a patient, Mr. Lee, age 68. He thought his loud snoring was just a joke in the family. But one day his granddaughter told him she counted the seconds when he stopped breathing in his sleep. That was the turning point. He went for a sleep study and was diagnosed with obstructive sleep apnea. Without treatment, his risk of high blood pressure and stroke would have skyrocketed. Tonight in this video, we'll uncover why seniors snore, how it connects to health risks, and, most importantly, 7 effective ways you can reduce or even stop snoring. Before we dive in, comment below if you or your partner struggles with snoring so we can create more videos to address your situation. Why does snoring become so common as we age? The main reason is airway collapse. As we get older, the muscles in the throat lose tone. When you lie down, the relaxed tissue vibrates as air passes through, creating that loud, rumbling sound. Add in factors like weight gain, nasal congestion, or alcohol before bed, and the vibrations get even worse. For seniors, this is not just a bedroom problem. Snoring is strongly linked with obstructive sleep apnea, OSA, a condition where breathing repeatedly stops for 10 seconds or more during sleep. Each pause lowers oxygen in the blood, forcing the heart and brain to work harder. Over time, this contributes to high blood pressure, irregular heartbeat, stroke, memory decline, and even depression. The statistics are alarming. About 50% of men over 60 and up to 30% of women after menopause have symptoms of snoring or sleep apnea. And yet, many dismiss it as just noise. Here's another angle. Snoring doesn't only hurt health, it hurts relationships. Many older couples I've worked with tell me they sleep in separate rooms because of it. While that may solve the noise problem, it can increase feelings of loneliness and isolation, which already weigh heavily on seniors. So snoring is more than an annoyance. It's a health signal and a relationship challenge. Understanding this connection is the first step toward reclaiming better nights and better days. Let me tell you 2 contrasting stories. Mr. Johnson, age 72, was a retired bus driver. For years, his family joked about his thunderous snoring. He brushed it off, saying, "If I'm asleep, I don't care." But slowly, his mornings became harder. He woke up exhausted, his memory was slipping, and he even dozed off while watching TV. One night, he woke up gasping for air. Weeks later, he suffered a mild stroke. Doctors told him that untreated sleep apnea and years of oxygen drops at night had damaged his blood vessels. Now, compare that to Mrs. Alvarez, a 70-year-old grandmother. Her snoring was loud enough that her husband couldn't sleep. But instead of ignoring it, she took action. She lost 10 pounds, switched to side sleeping, and tried a simple nasal dilator. Later, her doctor recommended a sleep study. With a CPAP machine, her breathing normalized. The change was dramatic. Her energy came back. She enjoyed playing with her grandkids again, and her relationship with her husband grew closer. The emotional truth is clear. Snoring can steal your energy, your health, even your relationships. But it can also become a turning point. By facing it, you can regain control, protect your heart and brain, and restore peace at home. So the question is, will your story be one of regret or one of renewal? 7 effective ways to stop snoring in seniors. 1. Change your sleeping position. When you sleep on your back, the tongue and soft palate collapse backward, blocking airflow. Simply turning to your side can reduce snoring dramatically. Some seniors use a body pillow or even sew a tennis ball into the back of their pajamas as a gentle reminder to stay off their back. 2. Maintain a healthy weight. Excess weight, especially around the neck, increases pressure on the airway. Research shows that losing even 5 to 10% of body weight can significantly reduce snoring and sleep apnea severity. For example, one patient of mine lost just 15 pounds and noticed his wife no longer had to wear earplugs at night. 3. Avoid alcohol and sedatives before bed. Alcohol relaxes throat muscles, making the airway more likely to collapse. Seniors often enjoy a nightcap, but even one drink before bed can worsen snoring. The same is true for sleeping pills. Ask your doctor before using them. 4. Keep the nose clear. Nasal congestion forces mouth breathing, which increases vibrations. Simple tools like saline sprays, nasal strips, or allergy treatment can open the airway. Seniors with chronic sinus problems should see an ENT specialist. 5. Try anti-snoring devices. There are simple mouthpieces, mandibular advancement devices that keep the jaw forward and the airway open, as well as nasal dilators that widen the nostrils. These devices are inexpensive and often effective for mild cases. 6. Practice throat and breathing exercises. Strengthening the muscles around the airway can reduce snoring. Singing, yoga breathing, or specific oropharyngeal exercises, like repeatedly saying vowels A-E-I-O-U loudly, have been shown to improve snoring in studies. Just 10 minutes a day can make a difference over weeks. 7. Seek medical evaluation for CPAP if needed. For moderate to severe sleep apnea, a CPAP machine is the gold standard. It delivers steady air pressure through a mask, preventing airway collapse. While some seniors fear it's uncomfortable, modern CPAPs are smaller, quieter, and life-changing. Patients often report better sleep, more energy, and lower blood pressure within weeks. Start small. Pick one or two of these strategies tonight. Even small improvements can restore peaceful sleep, protect your heart, and improve your quality of life. We began with a simple story, snoring so loud that a spouse had to leave the bedroom. But now you know, snoring is not just a sound, it is a signal that your airway may be narrowing, that your body may be struggling for oxygen, and that your heart and brain could be at risk. The good news? You don't have to accept it as a normal part of aging. By changing your sleeping position, keeping a healthy weight, clearing your nose, avoiding alcohol, trying simple devices, practicing throat exercises, or working with your doctor on CPAP therapy, you can take back control. Think of Mrs. Alvarez, who turned her nights of loud snoring into peaceful sleep and joyful mornings with her grandchildren. That can be your story too. Imagine waking up refreshed, feeling more energetic, and sharing quiet, comfortable nights with your loved one. Here's my message to you. It's never too late to breathe easier, sleep deeper, and live longer. If this video helped you understand snoring better, please like, subscribe, and share with your friends and family. And don't forget to comment below. What's the biggest challenge you face with snoring or sleep? So we can make a future video tailored to you. Together, we can turn sleepless nights into restful ones and silent suffering into healthy living.